What's up everybody, this is Scott, the TACMed EMT. Welcome back to the channel. We got a new video for you guys today on wound packing. Hey, if you like the content, please like and subscribe. We really appreciate it. So, wound packing skill is usually reserved for massive hemorrhaging in a junctional area, right? These are areas of our body where we need to control bleeding, but they are places that we can't get a tourniquet on, because it's not like an extremity, or a pressure dressing is going to be insignificant to control the bleeding. So in those junctional areas, we're going to need to pack that with a hemostatic gauze. Areas I'm talking about for junctions are going to be your shoulder areas, maybe your neck. We'll talk about your back as well in a minute. It's going to be underneath your armpit area or your lower inguinal areas. Right? Using direct pressure and tourniquets on extremity bleeding is pretty straightforward for EMS providers. We use those tools in the field all the time, or those interventions. But wounds in those junctional areas or in those groin and axilla where we can't get a tourniquet in, or that pressure dressing isn't enough to control the bleeding internally, we have to aggressively manage that bleed. So to do so, we're going to use a skill called wound packing. Again, this is an internal bleed, it's deep, and the external pressure is not working, so we're going to need to exert some internal pressure into the body. So that will help us control that bleeding by filling that wound cavity, allowing that hemostatic agent to work its magic. And then eventually, hopefully, control the bleed, cover that with a pressure dressing, and transport them to definitive care. Now, when we talk about wound packing, I'm talking a significant hemorrhaging event, right? If it's a minor bleed, you probably don't need to wound pack that. Minor bleeds, direct pressure, a good solid pressure dressing, well secured in place, will suffice to control that. I'm talking like a major bleed internally. Let's talk about the neck real quick. There's a risk of airway compromise. So if you have a carotid hemorrhage or severed carotid artery, you need to address that, right? Bleeding control is number one in a hot zone environment, but we also cannot occlude our patient's airway. So could you pack in the neck? Potentially, right? Is there an airway problem? Potentially, so be careful. Let's talk about back wounds real quick. Typically, they don't require packing. If it's a through and through wound, like a gunshot wound where you have an entrance and an exit on the back, you're going to cover that with an occlusive dressing. I'm way more concerned with like a tension pneumothorax or pneumothorax situation. However, a small wound in the back, there are a lot of muscles in that area. There could be some bleeding there. We may need to get deep inside that wound to control that bleeding. You're going to have to assess your mechanism of injury, make your best decision on scene. Even in an extremity, even though you tourniquet it, if that doesn't adequately control bleeding, either tighten the windlass, you may have to apply a second tourniquet. If that doesn't control it, you may need to resort to wound packing even though you put a tourniquet in place. All right, so again, always, first step, let's apply direct pressure. While we're doing that, we're gonna access, there's our combat gauze, there's our Celox brand, or we have the HemCon. These are all gauzes that are impregnated with a hemostatic agent. You can use just standard, this is just some NAR gauze. Just follow the same steps. First thing I'm going to do when we start to wound pack is I'm going to put my finger into that wound and I'm going to feel around for the source of that bleed. I'm looking for pressure or pulsing to find out how deep that wound is. Right? If it's penetrating trauma, though, be careful. As you got your PPE on, there's going to be fragments of that jacketed bullet, fragments of the bullet itself, bone shards. Say the round went through some medium, like some glass on its way into, it's going to carry that medium into that wound as well. So as you're feeling around, also remember, be careful. It's not necessarily a clean wound as you're reaching in there. Reach in there, find the source of that bleed as best you can. And when you target that vein or artery, start to immediately apply pressure to the source of that bleed. Let's harken back to some anatomy here. Remember, major vessels usually follow bones. So if you can compress that vessel or artery against the bone, that will help control that bleed temporarily while you get your hemostatic gauze in contact with it. It's also going to give you direction. Does the wound go to a superior or inferior direction? How deep is it? How much gauze you're going to need? Sometimes you might need more than one package to successfully address that wound. All right, so now we're gonna pack the wound. I want you to pack it tightly, right? These little packages usually come in about a 4-yard length, so about 12 feet of gauze. You wanna fill that wound cavity as much as possible to stop the bleed. So begin packing the wound with one finger, maintaining pressure. Okay, overlap that finger. We'll do a little demo for you in a minute at the end of the video. Your goal is to maintain constant pressure on the source of that bleeding. Get as much of that gauze in there as possible. Fill that wound with gauze until no more will fit. Now, if it's a fairly shallow wound and you get, say, half of the gauze in there, there's a bunch of that extra gauze on top. We're going to not let that go to waste. We're going to put that on top of the wound. We're going to pile it up there and we're going to apply direct pressure for 3 to 5 minutes. No peeking. No peeking, right? 3 to 5 minutes of good, solid, direct pressure. Let the hemostatic agent that's in that gauze do its work for you. If you notice the gauze starting to become saturated with blood, then we didn't get in contact with the source of that bleed. So we're gonna have to remove all of that gauze. We're gonna have to get a new package out and we're gonna have to repack using the same steps, right? If we do get the bleeding under control by applying direct pressure for that 3 to 5 minute window, the packing is good. It's holding and controlling the bleeding with the hemostatic agents. It's clotting out the way we want to. Then we're going to need to apply a pressure dressing to hold that in place. And from there, we're going to make this patient a priority transport. So secure that pressure dressing. Now, if you do need to move your patient, every time you move your patient, you reassess your interventions. Does that make sense? So say we move our patient and bleeding starts again. Well, we're going to have to either reassess the pressure dressing or maybe pack more gauze into that wound or start over wound packing yet again. If we have field movement during our CASEVAC and it does dislodge that packing and hemorrhaging starts to resume, at this point, I don't want you to delay transport. We need definitive care. We need it quickly. So get them to your ambulance, get on the road, and let's pack while we transport. Again, in all of this, I'm just some guy on the internet talking about medical stuff, right? Follow your policies, follow your local protocols, follow your, for California, we have Title 22. Whatever your state says, follow those agency policies put forth, right? Pack and transport if you can, get them to definitive care, right? So some of the problems with wound packing. My EMS providers, my law enforcement guys, they're a little shy when it comes to putting your fingers inside somebody else's body to get into that wound. There's some hesitancy there. It's understandable. It's weird. But remember, your goal here isn't try to harm the patient, it's trying to stop the bleed. If you don't stop the bleed, that's going to harm the patient way worse. You are helping to save their life. You need to not be timid. You need to not be hesitant. You need to get in there. You need to be aggressive. You need to fill that wound with gauze and make sure that it works. All right, so what we're going to do now is we're going to take a short cut here. We're going to actually show you a wound packing demo. To do that, I've got some training tools here that we're going to use. I like this Focus Research. This is a wound packing cube. These are relatively inexpensive. You can buy them on their website. They do have some complex versions of these that actually do bleed as well. So they're a great training medium. Basically what the wound cube looks like, it's like a little silicone cube. It has different wounds. So we've got a big, slash wound here. A couple of smaller GSWs, larger GSW. It's a really good training medium. They're relatively inexpensive. I really, really like the Focus Research Group stuff. And we've got some training gauze. This is just regular Z-folded gauze from Combat Gauze that we're going to use to pack that wound. Check out Focus Research. They also make some really, really good IFAC components. Highly recommend some of their stuff. Focus Research, PHOKUS. I don't get paid any money from them. I wish they would sponsor me. That'd be great. But honestly, they make quality gear. I know a lot of guys in the field that carry it. Some of our SWAT operators carry their Focus kits underneath their vest, or they really like those pocket kits. They make quality gear. I'm not going to recommend bad stuff to you guys. So we're going to cut it here and let's transition. Let me zoom in on this Focus kit and we'll do a close-up on wound packing. So hold on one second. Okay, TACMed fans, here we go. We're going to use this penetrating GSW large wound cavity here for our demonstration on our focus cube. We're going to open up our quick clock combat gauze training. This comes in a Z fold style, right, where it's folded back on itself a couple of different ways. Some guys take it completely out of the package. Some guys will leave it in the package and sort of feed it out. I've seen people just toss it over their shoulder, right, either way. Whatever kind of works for you. We're not too worried about contaminating the gauze. We do want to protect our patient, obviously, but with any kind of penetrating trauma, they're probably going to get some decent antibiotics when they get to the hospital. So I'm going to look and assess my wound. First thing I'm going to do is I'm going to reach in. I'm going to try to feel the depth of that wound. Right, feel for that source like I talked about, and start applying pressure. I'll take a little bit of this gauze, and I can either bundle it around my finger, pinch it, whatever I want to do, and I want to reach down inside here and put that gauze in contact with that wound and maintain that pressure. So now I can hold pressure with this finger. I'm just going to wrap with this and put in a little bundle, and I can hold with this finger, or what some of you guys will do, one technique is as I'm holding with this finger, I can wrap a little bit more, push it deep down inside, and then let that other one finger continually hold pressure. Whichever you choose to do is going to be based on technique and appropriate for the time. So I like the sort of overlapping technique. We're holding pressure, I'm holding pressure, holding pressure. And again, like I said, my goal is to continually pack this wound until I can get this thing full of all the combat gauze that I need to. Right, give a little twist each time, put that combat gauze deep inside in the pocket of that wound. I fill that wound cavity. Going to pack, trying to maintain that constant source of pressure. About how much pressure should you be pushing? I'm guessing at least 5 to 7 pounds with your fingertip every time as you just keep inserting this into the wound. We're packing. Right. One other technique you can use is you can pack it like a clock at the 12, 3, 6, and 9. So you're making sure you're filling that wound all the way around. It's going to depend on the size of the wound. That works really well for larger lacerations that are bigger, have more space. As you pack deep to the source of the bleed, then you can pack all the way around to make sure you're getting all of that hemorrhaging coming out of the tissue as well. And we're just going to pack. You can see there's a lot of gauze that goes into just this little shallow GSW here. Right. So get to the end, continue packing. It looks like I've got as much gauze as I can get on there. Remember, there's still hemostatic agent embedded in this. I don't want this to go to waste, so I'm just going to put this on top. And that 3 to 5 minutes of direct pressure without peaking. Once I apply that 3 to 5 minutes, I'm going to assess my bandage, right, and check for placement to make sure it's good. If it's saturated with blood, right, blood is filling this up and it's not stopping the bleeding, we need to pull this whole thing out, and we're going to have to start over. Right, if it still maintains white on top, it's not saturated, you've controlled the bleeding with this, then we would put a pressure dressing on it, transport our patient, priority transports, reassess every time you move. So those are some basics on wound packing. There's a quick demo for you guys. Thanks again, like and subscribe. See you soon on the next video.